The America's Democrats podcast, a project of 21st Century Democrats, is made possible by contributions from our listeners. Want to do more? Go to americasdemocrats.org and click Donate. And thank you for allowing us to be your voice. And if you enjoy the show, please share it with your friends on Facebook and Twitter, and leave us a review on your favorite podcast app. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. I'm your host, Jim Cuddy. This week, healthcare advocate Laura Packard on why it's time to build American healthcare back better. Former Secretary of Agriculture Dan Glickman on his new book, Laughing at Myself, plus Bill Press with Philip Bump, national correspondent for the Washington Post on pandemic politics. Had enough of Fox News, the House Freedom Caucus, and Donald Trump? If you want the facts that you won't get from them or from the fake news sites of the alt-right, then stay tuned. Our sponsor, 21st Century Democrats, works hard to get everyday Democrats involved in returning our party to its roots and to success at the ballot box. Sit back and listen, then stand up and fight. And follow 21st Century Democrats on Facebook for all the latest progressive news. We're glad you can join us. President Biden's Build Back Better agenda includes critical provisions that would expand and improve health care. If the bill passes, healthcare activist Laura Packard says it will be a game changer. And we say hello to Laura Packard, healthcare advocate, award-winning progressive digital new media and communications strategist based in Denver, Colorado. She's also the founder of Healthcare Voices, which organizes adults with serious medical conditions to tell their stories. And, in her free time, executive director of Healthcare Voter. Laura Packard, thank you so much for joining us today on the America's Democrats podcast.
Thank you for having me.
Our pleasure to have you with us. Now, you work on affordable health care. It's both deep and wide, and we'll talk about that work in a moment. But first, what got you involved with the issue?
Well, the AFL-CIO sent me to Arkansas in 2009, and one of the things I worked on was getting the Affordable Care Act passed in the first place. So that was probably the first time I started working on healthcare issues. But then 4 years ago, I was diagnosed with cancer, and the Affordable Care Act saved my life. So it has been a passion of mine in recent times.
I'm sorry you had to go through that, and glad to hear that that you're on the other side of it, I guess, at this point. You also just recently were appointed as executive director of Healthcare Voter, so congratulations to you for that.
Thank you.
This organization aims to hold politicians accountable for their support of affordable health care. What are some of the key policies you want to see politicians support?
Right now I'm on a bus tour talking about healthcare, and some of the key pieces in the Build Back Better plan that Congress is working on right now that Healthcare Voter supports is lowering the cost of prescription drugs, making the Affordable Care Act more affordable, because right now the subsidies that were in the American Rescue Plan expire after next year, and expanding Medicaid to fill in the gaps in the states that refused to expand Medicaid. So that means millions of Americans are priced out of healthcare in places like Florida and Georgia and Texas. So there are a whole bunch of healthcare provisions in the Build Back Better bill, which I'm happy to talk about. Those are the key ones that Healthcare Voter is focusing on.
And we will definitely touch on some of those. But I want to start here. Much of your accountability work focuses on Republicans. What are your biggest concerns about Republicans and their approach to health care?
Well, first of all, there are many Republicans still in office that voted against our health care, voted again and again against our health care. There are senators like Ron Johnson and Marco Rubio that are still in power. And if they had the opportunity to repeal the Affordable Care Act and strip away health care from millions of Americans, they would do it. So there are these people in power that are a threat to our healthcare. And even the new crop of legislators seem to have no interest in strengthening and expanding healthcare, just in taking it away to give tax breaks to their corporate buddies.
What about Democrats? Are they doing enough to support affordable healthcare?
Well, it's a little early to be asking that question because we'll see what happens in the next month or so, whether they deliver or not. the elected Democrats have made a lot of promises, and this is their opportunity to fulfill those promises. I was honored to speak with Joe Biden at the Democratic National Convention, and he promised to make healthcare more affordable. He promised things like a public option to fill the Medicaid gap, and this is his chance. This is the 50 Democratic senators' chance to do what they said they'd do.
How hopeful are you that it comes to fruition? Any of these promises?
I think we have a decent chance, but there's a whole lot of factors that we don't really have control over, which is, we need 50 votes in the Senate, and it's clear that no Republican will vote for healthcare. So if any of our senators are unable to vote or choose to vote against the Build Back Better, then it's not going to go anywhere. So it is a very delicate dance happening in the next month or so. I am optimistic, but we are certainly not there yet. And we'll see at the end of the year whether we got there.
Cautious optimism?
Yes, I am cautiously optimistic.
All right. Now, one of the strategies of Healthcare Voter is to mobilize voters to hold their legislators accountable. What is your sense of how important this issue is to voters right now, and how it ranks against other issues that may determine how they vote in 2022?
Well, I think in the middle of the pandemic, it's been more clear than ever how important healthcare is, that you need to be able to see a doctor when you need to see a doctor. You need to be able to get vaccinated or get access to medications when you need to. And if your neighbor is not able to get the healthcare they need, it directly affects you. So I think that unfortunately, that this pandemic is not going away anytime soon. It is certainly possible that next year we'll still be dealing with it. I mean, who knows with variants and everything else? We just don't know how long this is going to last. And a small minority of people refusing to get vaccinated is really screwing everything up for everybody. But it remains to be seen what the situation is going to be with the pandemic in next November. But I think the inequities in our healthcare system that it's revealed, those are not going away anytime soon. So people can't afford the drugs that they need. What's happened with the price of insulin in the past few years is criminal. So, if those problems aren't going away, it's going to still be a top issue next year.
It's interesting. So you mentioned the insulin crisis is what I will refer to that as. And, all these people that were going to Canada or to Mexico, and now they can't because of the pandemic. And it makes a really, really horrible situation worse, which is unimaginable. We're speaking to Laura Packard, healthcare advocate. She is the founder of Healthcare Voices, which organizes adults with serious medical conditions to tell their stories. And also, she's the executive director of Healthcare Voter. Laura, another project you're currently involved with is the national bus tour, which you mentioned a few moments ago, with Protect Our Care to advocate for better health care. So tell us a little bit about where the tour is going and what you'll be doing at the various stops.
Sure. Well, this tour started at the beginning of August. It's running 4 weeks through Labor Day weekend, unless it gets extended. But for the moment, it's 4 weeks. It finishes up in Las Vegas at the end of the week. But we started in Maine and we go all the way to California. So it's, I think, 17 or 19 states. And at every stop, we're talking about the importance of healthcare, sharing our personal stories, and calling on our legislators to vote for Build Back Better.
And one of the messages of the Protect Our Care bus tour is support for the healthcare pieces of the Build Back Better agenda, which you mentioned. How important is that fight in the overall context of affordable care?
Well, this will really be a game changer in the U.S. healthcare system if it passes. Not only filling the Medicaid gap so low-income Americans can get healthcare, making ACA policies cheaper, also strengthening Medicare to include vision and dental and hearing coverage, extending supports for home and community-based services so that seniors and people with disabilities can stay at home and don't have to move to an institution if they don't choose to, possibly expanding SSI, the payments for seniors and disabled Americans, so that right now they're pegged way below the poverty line. Family and medical leave for Americans. So there are so many different pieces in this bill. And if you look right now at Florida and Texas and so on, the states, Georgia, that didn't expand Medicaid, their rural hospitals, their whole medical systems are really suffering because hospitals have had to close because they couldn't cover the cost of uncompensated care. So this is shoring up our medical system across the board in states that refuse to do the right thing. And, Alabama and Mississippi right now, it's terrible what the pandemic is doing to their already decimated healthcare systems, and this will help with that.
Mm-hmm. Now, we talked a moment ago about how all of this is happening in the middle of the COVID-19 pandemic, which, we thought we were past it, and now all of a sudden we're back into it, almost worse than we were. In some places, it is worse than we were. And it's one of the most dangerous challenges this world has faced in recent history. As you look ahead, what do you envision the impact of the pandemic on the movement for better health care? I mean, is it hindered? Is it somehow, in a way, supported? In other words, oh my gosh, I need help now. I'm going to be able to get it if we get this stuff through.
Well, going back to what I said earlier, I think it's made it clear the importance of having access to healthcare and having insurance coverage. I know that my partner didn't have insurance. He signed up for it during the first pandemic special enrollment period last year. So, there are many Americans that have taken advantage of this opportunity to finally get covered. Maybe they didn't know they had access to free or low cost care before. But also right now, what's happening that's especially tragic is there's all these natural disasters that are compounding the pandemic. There are millions of Americans without power in the Louisiana area, including hospitals without power, people with disabilities and people with medical conditions that need power to power their medical devices. And looking at the wildfires in California and Nevada, it's making everything worse because, when people have to flee their homes because of weather conditions, they're going to congregate in shelters and other places that, do they have enough PPE? Do they have enough masks? Is there enough space to keep people socially distanced? Or are people already going through tragedy, then going to go through the tragedy of rampant COVID-19 while they're going through temporary shelter? So it's such a bad moment right now with all these crises compounding. I think that it's more clear than ever that everybody needs healthcare, and we need to invest in our public health system instead of the constant cuts of the past few decades.
Well, and certainly the work that you're doing, the bus tour included, all of it is meaningful, and hopefully that message gets through to the people in Congress that need to make this happen. Laura Packard, healthcare advocate. She's the founder of Healthcare Voices, which organizes adults with serious medical conditions to tell their stories, and also recently named the executive director of Healthcare Voter, joining us today on the America's Democrats podcast. Laura, thank you so much for your time. We wish you the best of luck and would love to get an update down the road.
Thank you. And I'd be happy to come back, hopefully when I'm more stationary.
Very good. Thanks again, and we'll talk to you soon.
Thank you.
This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. We want you to sit back and listen to this americasdemocrats.org podcast, a project of 21st Century Democrats. But we need you to stand up and fight. Do you want to get involved and help get our party back to its roots and to success at the ballot box? You can make your contribution to help us keep this show going and to elect Democrats who will stand up for democratic principles. Go to americasdemocrats.org and click on Donate at the top of the page.
Social Security measure.
I believe that we must pass legislation to provide medical care.
This is our tradition. When our grandparents came to America, it was the Democratic Party which said, welcome. It was the Democratic Party, the party of Roosevelt and Truman and Kennedy and others, who said that America belonged to all its people, not just a handful of the rich or a few giant corporations. That's why great leaders like FDR fought so hard for Social Security, and why JFK stood up to the insurance companies and their Republican allies to get Medicare. It's not just one thing, or one time, in one place. It's about a whole history of standing up to the Republicans and saying someone has to be on the side of regular working people in America, whether it's defending Social Security or just the way your loved ones are treated on the job. That's what the Democratic Party is all about. And that's why this message has been brought to you by the Democratic Party. Working people like you and me.
Paid for by 21st Century Democrats. Not authorized by any candidate or candidates committee. This is the America's Democrats Podcast, the weekly podcast for stand-up Democrats. Coming up next, former Secretary of Agriculture Dan Glickman says working across the aisle is critical to getting anything done in politics, and humor can help. But first, we turn to Jim Hightower, America's #1 populist, for his common sense commentary.
Corporate acolytes and right-wing moralists constantly preach to laboring stiffs about the uplifting dignity of work. Of course, that's dignity as defined and controlled by corporate elites, not by workers, and the reward for it frequently includes on-the-job injuries and death. Not that CEOs and well-heeled investors intend to sicken, maim, and kill thousands of laborers every year, but they certainly do put them in positions that assure such unhappy results. For example, they demand that farm workers go sunrise to sunset picking crops in California's 105-degree desert heat, and that construction crews toil in the muggy, dog days of Florida summers, tarring condo roofs. Low-paid, powerless workers die, but no one in the corporate hierarchy did the deed, right? Heat was the killer. But wait, not only are aloof, air-cool bosses the ones who knowingly subject subordinates to deadly heat, but they're also the ones who hire squads of lobbyists and lawyers to kill simple, inexpensive rules to stop these deaths. Such rules as requiring ample water at work sites, ensuring paid rest breaks in cool spaces, training on-site managers and employees to detect and react to signs of heat stress, and imposing serious punishments for violators. Such sensible steps have repeatedly been proposed as official workplace policy for at least the last 50 years. But intense industry lobbying has killed the adoption of all attempts to prevent what amounts to workplace murder by corporate profiteers. Instead, the U.S. government pretends to protect workers by printing posters admonishing employees to beware of heat, basically telling them goodbye and good luck. This is Jim Hightower saying, but at last a real proposal has been put on the table by more than 110 grassroots groups. See it and join it by contacting Public Citizen, citizen.org. Howdy-ho, folks. Thanks for tuning in and sharing my weekly commentaries. Also, please join me for a live web show I host every other Tuesday, the Hightower Lowdown Happy Hour at the Chat and Chew Cafe. You can join the action live online as I chat with grassroots leaders and progressive sparklies from around the country. Go to hightowerlowdown.org/chat-and-chew to find out about upcoming guests and watch past episodes. That's hightowerlowdown.org/chat-and-chew.
This is the America's Democrats Podcast, the weekly podcast for stand-up Democrats. In his new autobiography, Dan Glickman describes a long and successful career in public service that took him from the heartland of America to the halls of power in Washington, D.C. He says that critical to his success has been a willingness to laugh at himself, work across the aisle, and compromise. And we say hello to Dan Glickman, who represented Kansas's 4th Congressional District in the U.S. House of Representatives from 1977 to 1995, also served as Secretary of Agriculture from 1995 to 2001. And he is the author most recently of Laughing at Myself, My Education in Congress, On the Farm, and at the Movies. Secretary Glickman, thanks for joining us today on the America's Democrats Podcast.
Well, I'm delighted to be with you and glad to be talking to a lot of Democrats, too.
And our pleasure to have you with us, certainly. So let's talk about the book. Your new book explores your journey from, as you describe it, the middle of nowhere to a remarkable career as a congressman, Secretary of Agriculture, and chief lobbyist for Hollywood. So let's start at the beginning. Tell us a bit about your family and how they informed your political career.
Well, I think humor was in my DNA from my parents and grandparents. My grandparents were Russian Jewish immigrants who ended up in Kansas. They used to ask my grandfather how he got to Kansas, and he said he took the train. And, he said we were some of the first settlers in Kansas. We settled for 10 cents on the dollar, so that humor was, that shtick kind of made it through the family. But they ended up in Wichita. And my dad was in the scrap iron business, which was not an unusual business for a lot of Jewish immigrants who came to this country. And then he ultimately went into the oil and gas business. And then we owned the AAA baseball team in Wichita for the Chicago Cubs for years. We were also with the Texas Rangers, and we were not the most successful all the minor league teams, but he loved baseball. But in any event, I think politics was just always in my blood. I ran for a school board in 73 for Wichita School Board. I ran for Congress in 76, defeated an incumbent Republican. I was first Democratic congressman from my district in decades. And Kansas is not known as sending a lot of Democrats to Congress. In fact, we're the longest running state in the country that has not sent a Democrat to the United States Senate. But I managed to do well. And one of the reasons why is I focused on agriculture and heartland issues. And I think that put me in good stead. And I managed to stay for 18 years in the House. And then unfortunately in 1994, the Gingrich Revolution came, and my constituents had different ideas about what my occupation ought to be than I did. So I lost that last race.
Well, so you grew up in Kansas, Midwestern farming state, of course. But even before you were appointed Secretary of Agriculture, how did that experience attract and prepare you for a life in politics?
First of all, I think so much of it comes from your family. My parents were not particularly political. They were liberal, but they weren't political. So I guess, I think they were registered Republicans all those years because there weren't a lot of Democrats to vote for in primaries. But they encouraged my political involvement. I was a middle child. Who knows? Maybe being a middle child got me involved in politics in some way. But I watched my dad and mother, how they treated people. And it convinced me that politics might be a good profession for me because they were not of the kind that would build walls. They were building bridges. They were making friends. My dad and mother would make friends from the highest level of society to the dirt poor of society. And I saw the way they talked with people and related to people, and it served me well. And I think it just became part of my inner core. And then I liked politics. I was president of the senior class in high school. Actually in college. In high school, I was also involved in politics, but mostly non-ideological politics.
Now, one of the many stories you tell in your book is about your first congressional campaign in 1976. You ran against an 8-term Republican incumbent and won. What was it about your strategy during that campaign that worked?
I walked 35 to 40,000 homes door to door. I ran a race for Congress, kind of like what people think of as running a race for a state legislative seat. I spent a total of $100,000 in a primary and a general election against an 8-term incumbent Republican congressman. Today, you have to spend almost that much every day to cope. So I was able to run a true grassroots campaign, knocking on doors. I ran some television, but to give you an example, a 30-second spot on Wichita TV cost me $100. Today, that spot would cost $2,000, $2,500. So that grassroots campaign helped. And then I spent a big chunk of my time in the rural areas of my district, and that made a big difference.
You mentioned humor being a part of your upbringing. Has humor made a difference in your career? And if so, how so?
Yeah, self-deprecating humor has made a big difference in my career. And what I found is if you can make fun of yourself, people tend to like you. It brings down barriers. And so there are a lot of experience in my life I talk about in my book where where I laughed at myself, and that self-deprecating humor, I think made a big difference. I was not one to make permanent enemies. I had friends on both sides of the aisle. I talk about my relationship in the book a lot with Senator Bob Dole, who was the Republican leader of the Senate. And he worked against me in a lot of my races, but we got along really well when it came to agriculture issues. We worked together. He had a great sense of humor, and I saw how it worked with him as well. And today we're kind of in a humorless society. I don't know a lot of politicians who can really make fun of themselves in a what I call a sensible, self-deprecating way without looking like a fool. And I'm not arguing that politicians ought to be comedians, because most would not be good comedians. That's why they're not in that business. But we don't see a lot of humor. And the humor we see tends to be toxic, vitriolic type humor. And so I write in a book that positive, self-deprecating humor can go a long way to make you a successful politician.
We're speaking to Dan Glickman, represented Kansas's 4th Congressional District in the U.S. House of Representatives, also served as Secretary of Agriculture, and, of course, author most recently of Laughing at Myself, My Education in Congress, On the Farm, and at the Movies. And Secretary, another theme in the book is the importance of bipartisanship. And I think probably some of that self-deprecating humor helps that along. Was this something you knew even before you were elected to Congress, or was it something you learned while in office?
I think it was my desire to get things done. It had to do what I saw was a lot of real partisans, but I saw how rarely they were actually able to accomplish legislative achievements. And so the only way you could really do that is to have bipartisan relationships. That doesn't mean that you give up on your core beliefs, because you go in and you try to negotiate the positions that you think about. But our system works only if, especially with big issues, if you can work across the aisle. And that's been another problem in the last 10, 15, 20 years. There's been a reluctance on both sides of the aisle to try to reach bipartisan agreement on some of the major issues.
Well, and you make the observation that Congress is different now than when you served. How do you see what's changed, and what's your sense of why?
Too much money in politics. The racing after money takes half to 3/4 of the time of being in office. That's a big part of it, because when you're out raising money, you don't have time to do your work. And when you're out raising money, most of that money is raised to knock your opponents down, to be honest with you. So that is a big part of it. Our congressional districts are gerrymandered. So you're either in an almost all Republican district or an all Democratic district. And that makes it less likely that you want to compromise, because to do that, you have to kind of take on your political base a little bit. And that becomes fearful for most members of Congress to want to do that, because so I call myself an aggressive populist moderate. I don't know if everybody would agree with me on that, but I think that most Americans, their political philosophy is between the 40-yard line and the 40-yard line, to use the football analogy, not between the end zone and the 20-yard line. It may sound fun to be on the end zone, but you don't get anything done if you're on the end zone. So that was always my philosophy. And that's different today than it was 30 and 40 years ago.
And we seem to be seeing a lot less get done then. So it's that theory makes a lot of sense.
It used to be that you'd pass all the appropriations bills in a year. There were 13 of them, from defense to agriculture, you name it. Today, we don't pass any appropriations bills all the way through the system. We put them in one big, giant continuing resolution. And that's because we can't seem to get regular order to work in the Congress very much anymore. And the other thing I see now that I didn't see before was Congress gives up way too much authority to the president, especially on foreign policy issues of war and peace. And there's a lack of risk taking. I tell people that these jobs aren't meant to be permanent. And sometimes you got to take some risks. You wouldn't take a risk that would deliberately hurt your constituents, and you wouldn't take a risk that would hurt their jobs or their economic thing. But sometimes you got to take political risks. And I did. And I frankly, at the end, suffered because of it. With the issue of gun control or the issue of abortion, I voted the more progressive route, and it probably hurt me in the election. But you know what? I lost. Life turned out okay. So what I tell members of Congress today is, you can take some risks, and if it doesn't work out, there are plenty of other jobs in this world.
It's probably safe to say that there are Democrats who feel cynical that we will be able to ever return to a more bipartisanship culture in Congress. Do you ever feel the same way?
Well, I'm. It's when everybody's out raising money, and I get 100 requests for money a day, and the requests come in and they tell you how bad the other side is. Both sides of the aisle do that. The public gets turned off by this, and that's what worries me the most, is the public losing confidence and trust and faith the system works. I think it's a little better at the state and local level, and where people have direct contact with their elected representatives on a daily basis. You're watching what's happening in Louisiana and New Orleans today. Those folks, the people in those districts, are not worried about ideological issues. They want to get their power back on. They want to get the roads cleared, and so it tends to work a little better at the local level than it does at the federal level.
Mm-hmm. Now, you are critical in the book of fellow Democrats for giving up on the rural vote. Looking ahead to 2022, what advice would you give to Democrats who want to win over those voters?
Well, first of all, a big thing is show up, pay attention. I think that Hillary Clinton was criticized when she ran for president for not showing up. I don't even think she went to Wisconsin. So what I find with rural voters is show them respect. They're a big chunk of the American population. They care about the same issues that most people do: healthcare, education, taxes. I mean, they have a special interest in many cases in terms of farm or agricultural issues. But just showing up and showing respect and listening is really critically important. That's why God gave us 2 ears and 1 mouth, for a simple reason. We're supposed to listen twice as much as we talk. And that's certainly one big thing. And the other thing is that there are issues that rural Americans need to focus on, broadband, internet connectivity. I mean, issues that they have been left out a lot on. Enforcement of antitrust laws. A lot of people in rural America feel that we're allowed consolidation to take place all over this country in various fields, including agriculture. So I think the biggest thing is just to be there, to listen and show respect.
Dan Glickman, former congressman from Kansas, former Secretary of Agriculture, and of course, author most recently of Laughing at Myself, My Education in Congress, on the Farm, and at the Movies, joining us today on the America's Democrats podcast. Mr. Secretary, we appreciate your time. Would love to do it again soon.
Anytime. Thanks.
Thank you. And this is the America's Democrats podcast, the weekly podcast for stand-up Democrats. We want you to sit back and listen, but we need you to stand up and fight. Help get our party back to its roots and to success at the ballot box. Make your contribution to keep the americasdemocrats.org podcast, a project of 21st Century Democrats, on the air, and help elect stand-up Democrats. Go to americasdemocrats.org and click on Donate at the top of the page. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. And now Bill Press talks with Philip Bump on how Donald Trump stoked the pandemic response into a Republican partisan issue.
Let's start with something which fascinates me and you've been writing a lot about. How did a healthcare crisis, a serious national healthcare crisis, maybe the most serious ever, become such outright political warfare?
It's a complicated question. I think this is one of those questions that will probably be best answered by some 400-page book in the year 2030, right? I mean, well, we're sort of going to have to wait and see what all of the different details of it are. Right. But I think that we can point to one pretty obvious cause here, which is that this pandemic happened to emerge in the middle of what was an election year for a president who was very, very concerned about winning a second term in office. And as such, made a series of decisions which were really focused on downplaying the threat that was posed by the pandemic promising that it would all go away, that there were miracle cures right around the corner, assuring everyone that the economy could very quickly get back to normal, and therefore that America's economic strength could return very quickly. And when faced with internal dissent from people like the country's top infectious disease doctor, Anthony Fauci, decided to cast those dissenting voices as somehow aberrant or incorrect, instead of actually embracing the recommendations and warnings that they were offering. And I think all of that combined with whatever the motivation was for sort of passing on mask wearing, which may also have been related to trying to downplay the pandemic, all of that combined really baked in a sense of partisanship here from probably March or April of 2020 that obviously lingers.
Right. It's sort of assumed if you're wearing a mask, you're a Democrat, right? Or if you're practicing social distancing, you're a Democrat. And if you don't have one, I just came from a supermarket and almost everybody in there was masked, but there were a few who were not, and you almost assume they have to be Trumpers.
And obviously, it depends on where you are to some extent. And I think there is still some lingering, sense among people who are fully vaccinated that they can go and do those things without masks. So, that is obviously you're casting, you're painting with a wide brush there intentionally.
Right.
But yeah, I mean, we've seen polling that suggests repeatedly that not only are people who are opposed to mandates about mask wearing, or even say they regularly wear masks, not only do they tend to be Republicans, but they also tend to be people who are not as worried about the pandemic and who don't intend to get vaccinated against the coronavirus. Those things all overlap. It's just broadly a lack of concern about the pandemic and about the virus itself, and that happens to overlap pretty significantly with being a Republican.
And as you have pointed out, very graphically and statistically, there's a direct correlation, right, between red states and the severity of the disease, particularly with the new Delta variant, in terms of the number of red states, which are among those reporting the highest number of new cases, the highest number of new hospitalizations, and the highest number of deaths. Shouldn't somebody be able to connect those dots?
Yeah, I mean, it's sort of like presenting a kid a connect the dots that's already been filled out. Like, you don't even have to connect the dots, right? You can already see the image for what it is, to extend the analogy there. But yeah, I mean, you're absolutely right. I mean, this is, there are a couple of things happened here. During the spring, there were a couple of governors, Kristi Noem in South Dakota, Ron DeSantis in Florida, Greg Abbott in Texas, who decided, seemed to have made the calculus that they could both remove mask mandates because the situation was improving pretty dramatically, and also make it a political stand. We're anti-mask mandates. We're never going to bring these things back. Ron DeSantis, as of a couple of weeks ago, is actually selling merchandise on his website, that is mocking Anthony Fauci's recommendations. Then all of a sudden the Delta variant emerges. And these states, as you mentioned, there is a very strong and obvious correlation between the uptake of vaccines in the state and how it voted last year. I mean, not only is it that red states are less likely to have a lot of people vaccinated, but the more red it is, the fewer people are vaccinated. And so those places really got slammed when Delta emerged. There are a lot of factors at play here, not only vaccination, including, for example, policies like, sort of a laissez-faire approach to the virus that as we're seeing in Florida. But that correlates. And so I actually looked at the numbers yesterday, and right now, the rates, the population-adjusted rate in red states as compared to blue states is twice as bad for cases and 3 times as bad for deaths. That doesn't need to be the case. I mean, there's something different happening in those states, and it's impossible not to say that it must somehow be related to this partisanship.
These numbers, which I quote, I trust implicitly because they come from one of your recent columns, that 8 out of 10 states that have the most new cases voted for Trump. 9 out of 10 of the states that have the most new hospitalization cases are red states. 8 out of 10 that have the most deaths are red states, right? I mean,
right.
Can't deny that evidence. I mean, there's a real connection between believing the big lie, voting for Trump, believing the big lie, and not getting vaccinated.
Yeah, that's an interesting overlap too. So one of the things that we see is there are actually way more Republicans who believe that the election was stolen incorrectly than there are that say they aren't going to get vaccinated. But essentially all of the ones who say they aren't going to get vaccinated are people who actually also believe in the big law. And I actually went back and looked. There's sort of this group of conspiracy theories that's included that includes those two, and it's something like 12% of Republicans broadly that adhere to this wide range of conspiracy theories, including both of those. But yeah, those two alone, there's a substantial chunk of the Republican Party which believes both of those things. Obviously, both detrimental to the country in different ways. Could
Donald Trump have made a difference? Have helped if he were actively, aggressively urging people? After all, he should get. I would give him some credit for the speedy development of the vaccine, right? Could he have made a difference by going out there and saying, hey, we got this vaccine, now go out and you can get it?
This is a fascinating question. It really is, because, speaking of things that will end up in, having books written about them.
Right.
It's really hard to say. I mean, one of the things that we're seeing, we saw this rally last weekend, for example, in Alabama, where Donald Trump came out and, he's desperate to get credit for the vaccine, which he thinks can be viewed as the salvation of the entire pandemic. He really, really, really wants that credit. But at the same time, he doesn't want to help Joe Biden by having coronavirus cases go down with, as he sort of flirts with the idea of running in 2024. But at the same time, he spent so much effort. I mean, everything about his election in 2016, much less 2020, was predicated on the idea that he stood against the elites in Washington. And the elites in Washington are right now saying, everyone, go get vaccinated, for God's sake, save your own lives. And he recognizes that because the elites are saying that, his base is going to reject it. And again, he spent all of last year inculcating that sense by disparaging Fauci and, bad-mouthing the CDC and so on and so forth, hiring Scott Atlas to sort of do that from the inside. And so now he's in this position where he really, really wants people to get vaccinated. And so he says that in Alabama, and people boo him. And then he sort of shrugs and says, oh, no, but you got to have your freedoms, as a sop to this, this line of thinking. And so it's bizarre. But again, if he had come out in January and said, I just got vaccinated, everyone should do it, I think you still would have seen this strain of people be like, nah, I'm not going to do it because that's what the doctors, that's what the CDC says, yada, yada, yada. And because some people are just honestly a little afraid of it, and that they use that as cover.
It's almost like the tail wagging the dog, right? The base is demanding that they go in this direction. And even if Donald Trump says, well, maybe you ought to get vaccinated, then they boo him, right?
Right. Yeah. I mean, I think it's broadly good natured, but I mean, this goes to, this broader idea of how, and I wrote about this week or last week, but that from the time of the Tea Party, so pre-Tea Party, sort of the Republican establishment would set the direction, and the base is sort of expected to go along with it. And Barack Obama emerges, and the Tea Party says, "Hey, we're mad about these things," and so they try and corral the Tea Party and point them in the direction they want. Right, so that's them trying to sort of co-opt the base. Then Donald Trump emerges in 2015. And Trump's strategy is, hey, you know what, base, you're totally right. And the reason he won, I'm convinced of this, is because he basically parroted what was being said in conservative media back to a base which was hearing that in conservative media. And they said, hey, this guy's a truth teller, whereas all the Republicans who are established elected officials weren't going to say those things because obviously you don't say those things as a self-respecting elected official. So basically, Donald Trump empowers the base to be the ones driving the GOP formally. He then eviscerates the establishment as president in order to retain power for himself. And now it's in a position where not only is it that it's the tail wagging the dog, but the dog is all but vanished. It's just this tail floating in the ether wagging itself.
You mentioned already one of the key players in all of this, of course, who has decided, he's hooked his wagon to Donald Trump's star, is, particularly now we're talking on the COVID issue as well as others, is Ron DeSantis of Florida. He is, you've got Florida, which is certainly one of the leading states in terms of new cases, new hospitalizations, new deaths. And DeSantis is just, digging in his heels and refusing to do anything about it.
You've got, I think, I looked at the numbers yesterday, the day before, 15 to 20% of all new cases and deaths during this new surge have been in Florida, which obviously is substantial. Florida, not that much of the country. But yeah, this goes back to the bet that I think he made in the spring, that he could all of a sudden he could be a real COVID hawk on this stuff because the pandemic was fading, and then all of a sudden it wasn't fading. And so if you're in his shoes, you've got an eye toward 2022, your reelection, but really toward 2024 and appealing to the Republican base, you have to make a decision. Do you backtrack on saying that mask mandates are bad and evil and Fauci is a dope, or do you keep moving forward with that and come up with another way to try and curtail the pandemic? The third option, of course, is just to let it run rampant, which he has done to some extent. And so he sort of came up with this strategy of, hey, what if we just have all these therapeutics and make things like Regeneron and these whatever the monobody the monoclonal antibodies. I'm not a doctor by profession, obviously, but so he makes these drugs available to people, and it's sort of an inverse of an ounce of prevention is worth a pound of cure. It is, hey, don't worry about prevention because we'll cure you on the back end. Of course, setting aside all of the obvious risks that are associated with that, including now we're seeing these long lines of people trying to get this treatment. But that's what he's come up with because it means he doesn't have to go back and rescind on his promise that he wasn't going to reimpose these mask mandates because, again, he wants to make sure Republicans don't get mad at him.
And at the same time, he tends to change the subject or change the focus, at least, to Joe Biden, right? We're not going to let Joe Biden dictate what we do in Florida, right? Or dictate what Floridians do. So using it again with his eye on 2024 of attacking Joe Biden rather than dealing with the problem at home.
Yeah, but the really bizarre thing about that is Quinnipiac University came out with a poll this week that essentially shows that DeSantis overall his job approval is substantially better than Joe Biden's, but on COVID, it's the same. So he is not seen in Florida as doing a better job than Biden on the pandemic, and yet he thinks this is his ticket to success in 2024.
Well, I was going to ask you about whether this plays in Florida, and whether this plays outside of Florida.
I mean, it clearly plays outside of Florida in the context of the Republican primary, right? Obviously that's step one is his winning the Republican primary. And he has run so long as an acolyte of Donald Trump's. Donald Trump's strategy in 2016, 2020 was maximize turnout from the base and then hope that's enough to actually overwhelm turnout for the opposition. That worked for Trump in 2016. It worked to some extent for DeSantis when he first was elected by the skin of his teeth in 2018 as governor of Florida. And that may be his play, that in 2024, he hopes Donald Trump doesn't run. He hopes that the GOP base stands alongside of him, and he hopes he can then amp them up enough to actually win the White House. That may be his play. Does it work broadly? If you ask an average independent voter in the middle of, just to pick a stereotypical place, Peoria, Illinois, how they feel about Ron DeSantis. Is that compelling? I don't know. And I think part of it depends on, how much longer does Florida keep seeing 1,000 deaths a day from COVID?
Right. And just before we spoke here on the podcast, of course, a judge in Florida said that schools did have a right to require a mandate for incoming students, and that Ron DeSantis did not have the right to ban school districts from doing so. Which I guess sets him back a bit, but probably will not prompt him to change directions.
I mean, honestly, I think it's the best case scenario for Ron DeSantis, right? I mean, what it means is, A, that there will be actual preventative measures in place in schools where we've seen a lot of the new virus spread. Yep. B, he gets to rail against the judiciary, right? And C, he doesn't have to rescind his own mask mandate, right? So it's sort of like, what else could he ask for? It's likely the pandemic will get better and he gets to blame someone else for it. Win-win. So
the judge, in effect, let him off the hook, right?
It's an in-kind contribution to his 2024 campaign. That's right.
Let's talk about some of the other characters around Donald Trump. A judge in Michigan has said that not only did I throw Sidney Powell's lawsuit accusing Michigan election officials of using these rigged voting machines that were designed in Venezuela to change votes, not only did I throw that lawsuit out, but I think that there should be sanctions, fines against Sidney Powell and her colleagues, and they should be referred back to their state bar for possible disbarment. Add to that, Rudy Giuliani's being disbarred in New York. Not a good day for Trump lawyers or for the cause, I guess. Phil?
It's certainly a good day for justice, right? I mean, the thing about that statement, the decision from the judge, is that it was not only about the fact that these people came with this specious claims that they were absolutely and fundamentally unable to prove. And if you actually read it, the judge walks through all of these things were known to be false before the lawsuit was actually filed, as is indicated. But it really is. It's very pointed in saying this is an attempt to subvert democracy using the judicial system. She minces no words in that regard. And it's clear that she is not only frustrated from the standpoint of a judge having to deal with a frivolous lawsuit from bad lawyers. She is frustrated as a citizen of the United States who is saying, you are trying to hurt our country by doing this thing. And as such, you should face some sort of reprimand. That, I think, is the significant part of what that ruling says. And I think it's obviously entirely correct.
Yeah, I mean, she said the goal here, the real goal, was to undermine faith in the democratic process, right? Which, again,
right, which has been the playbook since midnight on November 3rd.
Bill Press with Philip Bump, national correspondent for the Washington Post. If you'd like to hear the entire episode, visit BillPressPods.com. And that's all for the America's Democrats podcast. Thank you to all who made today's show possible. Laura Packard, Dan Glickman, and the entire Bill Press team. And thank you for listening. If you liked what you heard, please get involved in our efforts to keep this show going and to elect Democrats who are bringing the party back to its roots. Go to americasdemocrats.org and click on Donate at the top of the page. And be sure to find 21st Century Democrats on Facebook and Twitter, and leave us a review on your favorite podcast app. For the America's Democrats podcast, I'm your host, Jim Cuddy. We want you to sit back and listen, but we need you to stand up and fight. Join us. Support the americasdemocrats.org podcast, a project of 21st Century Democrats, and help elect Democrats who will stand up for democratic principles with your contribution today. Go to americasdemocrats.org and click on Donate at the top of the page.